Hi, my name is Jocelyn, and the project is on management on asthma in athletes, and I'm doing it with my partner, Ostini Ramirez. Okay, what is asthma? Asthma is a chronic inflammatory disorder of the airways characterized by variable airway obstruction and bronchial hyperresponsiveness. It includes wheezing, breathlessness, chest tightness, and coughing. Asthma stimulated by allergens, pollutants, respiratory infections, aspirin, NSAIDs, inhaled irritants, particulate exposure, and exposure to cold and exercise. On a picture or that picture below, you can see um, three small diagrams of the airway. The first one to the left is a normal airway, and as you can see, it looks very healthy. And it's very relaxed. The second one, which is in the middle, is an asthmatic airway. And that one is the walls are inflamed and thickened. And then the far right one is an asthmatic airway during an attack, and that is air trapped in the alveoli and tight and smooth muscles. So, purpose of asthma management. It is to provide athletic trainers and other healthcare professionals who care for athletes with information like identifying the characteristics and diagnostic criteria of asthma, like exercise-induced asthma, which is EIA, or exercise-induced bronchospasms, which is EIB. Um, it provides guidelines for referral and for a thorough evaluation. And then you can create a management plan to prevent attacks and exacerbations. And then it is to educate certified ATs and athletes about pharmacological and non-pharmacological therapies and techniques to control asthma. Asthma identifications and diagnoses. So athletes must undergo a pre-participation screening evaluation, and this evaluates a thorough medical history from the athlete themselves. And then further screening, like a spirometry or challenge testing, is necessary in certain situations. Um, we can't always rely on the history because it's not a reliable method for detecting asthma. As you can see on the bottom, we have a picture, and that is actually spirometry or challenge testing. And basically, they clip your nose and then have you inhale and exhale. So that way they can kind of see where you're at with your breathing. So there are signs and symptoms to consider when suggesting asthma. As you can see, is a fairly long list, and it starts with chest tightness or pain, and that is common in children. Nighttime coughing, prolonged shortness of breath, trouble sleeping, wheezing after exercise, inability to catch breath, breathing issues during physical activity, use of accessory muscles to breathe, morning breathing difficulty, breathing trouble from allergens and irritants, exercise-induced coughing and wheezing, poor performance despite good conditioning, family history of asthma, and personal history of autopsy, also known as eczema and hay fever. Okay, next is screening questions. And the purpose is to seek evidence of asthma. And then there are 5 questions that they ask, and it starts with, does the patient have breathing attacks consisting of coughing, wheezing, chest tightness, or shortness of breath? Does the patient have coughing, wheezing, chest tightness, or shortness of breath at night? Does the patient have coughing, wheezing, or chest tightness after exercise? Does the patient have coughing, wheezing, chest tightness, or shortness of breath after exposure to allergens or pollutants? And lastly, which pharmacological treatments for asthma or allergic rhinitis, if any, were given in the past? Were they successful?
So testing. So testing is going to help in diagnosing asthma as well as identifying it. It's also going to help with monitoring lung function as well. So for testing, pre-participation screening evaluation, is going to be taken. Also, additional screenings such as biometry testing or the challenge test. Patients with atypical symptoms should be referred to physicians with sports medicine expertise and focus. These tests are going to include the stress electrocardiography, upper airway rhinoscopy, echocardiogram, and the upper endoscopy. Athletes with history in asthma and taking medication for it should consult a physician for proper evaluation. If diagnosis is unclear, athletes should be tested with metabolic gas exchange during strenuous exercise to determine fitness to rule out asthma. Asthma management. So there's going to be emergency action plans for asthmatic management and urgently referring patients that are having those life-threatening attacks. So this is going to include emergency facilities, making sure they're available during those times, maybe having their phone number, address, maps, just so we know where to go in case of those emergencies. Signs of respiratory distress and failure should be referred immediately to nearest emergency department for eval and treatment. All patients and athletic trainers should have a rescue inhaler always available for emergencies. This is also going to include on how to use those devices as well. Athletic trainers and coaches should have alternative practice sites when the air quality is poor, or even reschedule those games or practices. Asthma patients should have follow-up examinations regularly. This is going to help with maybe possibly changing up their therapy and just monitoring those things. As for treatment, there's going to be two different types of treatment, so pharmaceutical and non-pharmaceutical. So as for pharmaceutical, in exercise-induced asthma patients, they'll benefit more from those beta-2 agonists. Um, this is going to include albuterol and inhaled corticosteroids. Albuterol is going to be more of the short-acting, and the corticosteroid is going to be more long-acting. Another medication would be the leukotriene modifiers, inhaled parenteral corticosteroids, and chromones. These are all going to be different inflammation, dealing with inflammation into the airways. NSAIDs and aspirin intolerance can also use acetaminophen. And so the pharmacotherapy should be customized per patient, just because everyone's going to have different reactions, different symptoms, different stages of asthma. Most medications are delivered directly to the lungs by inhalation devices. And the most important thing to know about the medication is really know how to use them, what misuse looks like, and what abuse looks like. Okay, so again, the non-pharmaceutical treatments are going to be nose breathing. Breathing from the nose is going to help filter out those things coming in and out. And also, it's going to bring a little bit of moisture in the air as well. Limiting exposure to allergens and air filtration systems. So, warming up before exercise can also lead to a refractory period, leading to those non-reliance of the pharmaceuticals. Um, Diet's going to have a lot to do with this as well. So limiting that sodium in diet is going to help. And also following recommendations for different organization and programs for eval and asthma control. And those two there listed are really helpful because there's new information coming out weekly for that. So from key takeaways, so symptoms for asthma are going to be like wheezing, breathlessness, chest tightness, and coughing. Um, Asthma is stimulated by allergens, pollutants, respiratory infections, aspirin, NSAIDs, inhaled irritants, and particular exposures, as well as exposure to cold and exercise. So pulmonary screening evaluation. So again, the spirometry challenge testing, screen questions as well. Athletic trainer preparedness, again, is going to be the EIP. So the emergency action plans, closest emergency facilities, knowing those signs of asthma, recognizing um, what triggers it. Also, rescue inhalers, monitoring air quality, as well as follow-up exams for those patients. And again, pharmaceutical and non-pharmaceutical treatments as well. And there's our reference.